Your pelvis bone is, and right below your pelvis bone, there's a tensor fasciae lata muscle in here, and it's supposed to be a little valley here, and this is sticking up out of your body. See how I feel that like rope piece there? That should be a flat band instead of a round. Is that okay? So what this does, it makes your pelvis turn down and forward, and it puts the bone, shoves it up in your low back. And nobody ever works here. So what you do is a lacrosse ball would be your new best friend.
Okay.
It'll be where my elbow is.
Gotcha.
And you see how there's a drop there, then there's muscle up here, then there's more muscle up here again. That should be all one uniform piece of muscle. So we're kind of molding it, we're kind of rocking it side to side, we're kind of rocking it the opposite way the muscle goes. So that forces blood flow and circulation into that area. So that little band right there, that doesn't belong there. So you get 5 or 6 of these down your legs, your IT bands, your adductors and everything, and up here, it ruins everything. It makes it difficult for you to perform the task you want to perform. And then you can slowly roll up here a little bit more, then you kind of roll up onto your glutes. You just roll onto your side a little bit more to your back a little bit, and you just come right down this line. But as soon as you feel the pelvis bone, it's just right below it.
Okay.
Pelvis right here, and so we're just going to go like a ½ an inch below where the bone of the pelvis is. And we're just going to go right down and out in the little gap right below the pelvis. And all we're doing is creating some spacing here. Then when you have the lacrosse ball, will be right where my elbow is, and you can just move the ball. It's not big giant movements, it's very small, subtle movements. And then you can move back towards, you get a little bit farther back where it gets in towards your glutes a little bit. So that spot's not supposed to be there, see, so we're gonna kind of rock, make a little space there. And you can't expect, if you had things in your body for years, it's not going to leave in one session, but you get the right idea of how to get it to leave. And then when you roll more towards your back, then you can put the lacrosse ball right here.
That's kind of my area.
Yeah, when you put the ball there, you can lift your leg up and you can lower your leg back down, bend your knee and let it go fold out to the side, bring it back in. Any kind of movements that you can do to move it around with the ball there, that's an active release therapy. So it's you're breaking the muscle up, but you're also doing movement at the same time.